Welcome everyone to this week's classroom session. This is on forecast modeling and accuracy, that is finding error rates and to understand how accurate the forecasts are. Unfortunately, Gilles is not able to join this session. He has some family emergency he's attending to, so he sends his regret. And then he is in spirit with Team Blue, so he's rooting for them. Okay.
I think I will stand in for him as
Yes,
a support to Team Blue.
Absolutely. So Andrea will stand in for Team Blue. We also have a guest speaker with us today, Pierre Devisson. He is a senior supply chain consultant, and we see him as well now. It seems, Pierre, you are about to sleep, and we are kind of
I'm blue
you.
As well. I'm blue. I'm sorry.
It's okay. It's completely fine. So I was just saying for everyone, Pierre is a senior consultant, supply chain consultant, has been working in the sector for past many years. He is currently working in several francophone countries with leading organizations like Global Fund, Global Health Supply Chain Project funded by USAID, UNFPA, and several others. Pierre, say hi to our participants. They're still joining, but hopefully we'll have a good number of people joined in the next 10 to 15 minutes. Pierre,
Hello, everybody. Happy to be with you and to be a guest. So that I will disturb a little bit Sanjay and Andrea with my French accent.
All right. So moving on, we'll begin this session. Maybe Andrea, can you take us through what has been happening this week on the community? So over to you.
Okay. Hi everyone. Good morning, good afternoon, good evening. Good to see you all. Let's quickly go through what's happening this week. So we have modules 3 and 4 in progress. Module 3 has, I think everyone has gone through what is there. Should I read it out or?
No, it's okay.
Okay. So this is a snapshot of a discussion from module 3. Are we on the same boat? And this is a snapshot of a discussion from module 4. Are we on the same boat? Apart from these, there are other discussions that are happening in voice your opinion and comments, discussions that happen at the end of each lesson in these modules and so on. This is your progress. How much of the course have you completed? Has each participant completed? And you can see, I see slightly more red here. What do y'all think?
Let's not be biased. There is a lot of blue as well. The red seems more because it's a catchy color.
We'll see about that.
But no, I mean, sorry to just interrupt, Andrea, but I think this week more people have started to go through the course. There were some clarifications which we had to send to some participants who were not sure how to go through the course. So we have done that as well, and hopefully they will also start going through their courses as well. So I see two or rather four names, two from each teams, who are still like at 0 or 1%. So from Team Red, one is Romeo, who is there in the call, and Oluwa Pilomi Isiola. I'm not sure if he's there on this session, but we have reached out to him as well. And then from Team Blue, there is Joshua, with whom we are trying to connect. He has not yet responded to several of our emails, so we'll keep trying. And then there is Panchak Ignatius, whom we have written to, and he was very sorry that he was not able to understand how to go through the course. So he will probably begin from today or tomorrow. So hopefully by the time we finish this week, he will have progressed a lot in the course as well. Yeah. And if anyone wants to speak, on their experience of the course so far, please, we have 2 minutes. We can hear from you. There are some comments which are coming on the chat. So it's from Romeo. Yes, absolutely. Anyone who wish to speak at this point, it would be great. Otherwise, we would move to the first section of today's session.
Good evening, everyone. Hello.
Yes, we can hear you. Please go on.
Good evening. We are getting you, Mr. Fong. Please, you can go ahead.
Okay, it has been a wonderful experience. When I was getting into this course, I was wondering what I was actually going to gain from the course. But just going through with 1, with 2, especially this with 2, there is a lot that I've learned that I'm thinking and strategizing on how to apply it within the CDC health services so as to add value to the work we are doing in the CDC health services so that many more Cameroonians can receive healthcare. When I used to hear or going through my school, the studies that were given on supply chain was not so explicit. But with the short time with this key, I've come to realize many things that are so important when you're talking about supply chain. And I'm grateful to this team. And as they might have noticed, I'm bringing in a lot of people because I would love that many more people from Cameroon should join. Because if we do, then we will certainly take the healthcare system of Cameroon to another level. Thank you so much for your endeavor and everything you're putting in.
Thank you, Anfo Wilson, for sharing your experience with us. And absolutely, I think it goes without saying, for everyone who's part of this course, I think to take it to the next level, a key thing here is for you to be able to apply some of these things into your work. And that's the reason why we have established the community platform called Hive, so that you are always connected with all of us, even beyond the completion of this course. So that's why, I said in the first call as well that this is the beginning of your learning. This is, even after 4 weeks, when this course ends, your learning doesn't end, your growth, personal growth, professional growth doesn't end. And this community that we are trying to set up is exactly for this reason, that even when you finish your course, you want to apply some of those things in your workplace, you should be able to do that. You should be able to communicate with us, with other participants who are there, fellow countrymen. We have several of you from Cameroon, we have some from Kenya. So all of you should be able to also meet up, coordinate with each other and learn from each other within your countries and across different countries as well. And for that reason, I hope even after this course will be over, you will be engaged on the platform as we bring on new things. But we also believe that you, as a professional, can also take charge of this community, because this is all for you. Without your presence in that network, we can't achieve much. So it's for you. So you should take full advantage of that. Let's begin with today's session while Andre is launching the poll. So this week's session is on forecasting, forecast modeling, and accuracy. As you all went through week two's modules, one of which was on products. We call it product selection somewhere, but ideally what we're trying to understand in that module was what products do we purchase and supply through the supply chain. And then the following module was how we quantify those products. How do we know how much of product do we require in our supply chains? Okay. And this particular session, it is to understand a bit more into that process, which we call forecasting. We have designed this session for learning purposes. So the techniques and methods that we will discuss in this session, they are made a lot simpler so that we understand the concepts behind forecasting. Okay. Although you can use those concepts in real life, but you will have to design them for your own needs, depending on the products that you are quantifying, depending on the products in your programs, numbers, the data availability, and all that. So although we will recommend you to look over the templates that we have provided you, try to use them with your own data, but these templates are more for enhancing your learning rather than directly using them for practical purposes. Okay. Again, throughout the session there will be some polls and quizzes. Andrea, are you able to launch the poll?
Yes, it's in progress.
Okay, that's great. So please do let us know who do you think did well in the debate, and then there will be more polls regarding this session as well. Once again, if you want to ask any question, you can put it in the chat, or you can raise your hands as well. Okay. So quickly moving on. Once we finish this poll, we would like to start this session on a poll on forecasting. Andrea, if the poll is finished, then you can launch the next poll, and then I will start. You can show the results first, and then launch the next poll.
Okay, so I'm going to end the poll right now. And here are the results.
Okay, I'm not able to see the results, so you'll have to announce them.
Okay, so Team Blue has 5 votes, 42%, and Team Red has 7 votes and has 58%. So Team Red.
So congratulations to Team Red. I hope all of you did not vote because you were part of Team Red and you voted based on the responses and what you heard from the teams. So I hope it was not biased. So congratulations to Nutzele Alvin and Tata Stephen. You did very well. You did not disappoint your team mentor as well. Although in no way this debate was rigged, let me assure you that. But in the next coming weeks, Andrea, can you launch the next poll while I'm just summarizing this?
Yeah, sure.
Next coming weeks, we will try to reach out to more participants in some other topics to see if they would be interested in a similar process, maybe in a debate or a discussion during these classroom sessions, because we think that it gives you more insights on what you have learned in the course as well. So we start the session by understanding if you find forecasting difficult or not. There are 3 options. We would like you to choose from these options and let us know what you think about it. Let me try to. Okay, and Andrea, can I take back hosting? Okay.
Okay, the poll is in progress.
Okay, the poll is in progress.
Yes.
Okay, I'll just hand it over the host to you once. Yeah, okay. Yeah. All right. So let me begin very quickly. Now we'll see the results of the poll as it completes. But as we saw as we learned in our modules as well, the quantification process has 4 steps. At the beginning, we need to define the methodology and we need to understand what relevant sources of data are available to us. Based on that, we can define the methodology and then go on to do our forecasting. When we do the forecasting, we use those same data sources which we have defined, which we have identified that they are available. And based on that, we try to forecast what we are going to be needing in the next period, whatever the period we identified in our methodology. Then based on the forecast that we developed, we try to create a supply plan to understand when do we need the product, where do we need the product, and where are we getting those supplies from, if we have the idea. And we also try to do budgeting as well at that stage, a rough budgeting, without looking at how much money is available for procurement. At a later stage, we reconcile that budget with the procurement budget as well. And then once those forecasts are approved, they are reconciled. We have the supply plans. The product starts to come to the facilities, and actual consumption starts to happen. We want to collect the data to compare our forecasts against to see how accurate our forecasts were and how can we reduce our error rates going forward. So this is the 4-step process that we also talked about in the course. In today's session, we will talk about 2 out of these 4 processes. One is forecasting, which refers to predicting future events. Now, in this case, we are trying to predict how much product will we need in our program, in our, in the period for the hospital or a facility, and for any procurement and supply organization in totality for a country or a state. Okay, Andrea, do we have the results?
Yes. So 54% find forecasting difficult.
Okay.
38% find it quite easy, and 8% has never developed forecasts. That is 1%.
Okay. All right. So today we try to see how to, first of all, we understand the concepts behind forecasting. What are various methods to do that? What are the different data sets that we can, what are the different data sets that we can use to develop our forecasts? And then we look at how to monitor those forecasts against the actual data. Okay. So the way we will do this session is I will show you some slides, then we'll discuss a scenario, and then I will take you to the Excel template, which I've shared with you already. Okay. And then we'll show how to do those calculations on that template. The template you already have, I believe, on your system, so you can follow along, or you can also look at the template at a later stage. So before we start on the data sets, there is a quiz here. This is not a poll. This is a quiz. Andrea, can you launch the quiz? You have to select one option out of this, which you think is the out of these 5 options, which is the right option, which you can use as a data for forecasting. By the time you're doing this, I won't show you the next slide, but let me just wait for 10 seconds. And do you see the results?
Yes. So I think results are out. So 2 people have marked services data and 13 have said consumption data. So that's
okay.
all.
That's great. So let's look at these data sets. I'll put everything on screen and then talk about it. There can be different data sets that we can use in forecasting. 2 people said services data, which is right. We can use services data for forecasting. Most of you said consumption data because this is the most commonly used data set for forecasting, because this is the data set which is readily available to the supply chain organizations. A third data set which you can use is morbidity data. We can also call it surveillance data. We can also use disease burdens to calculate our product demand, and we will talk about it very soon. These slides will be also given to you, so I'm not reading the slides entirely, but consumption data is what is actually consumed by patients. Consumption data is not what let's say a central medical store has supplied to a regional store, or a regional store has supplied to a facility. That's not consumption data. That's either distribution data, or that's a supply data or issue data. Consumption data means actual consumption of products by patients. So consumption data should actually, in ideal scenario, should match your services data as well. Services data means how many patients or consumers actually visited your facility. Okay, so sometimes we also use services data to do forecasting. because we have some way of calculating that if this many number of patients would have visited or would visit the facility in a given time period, then this is the amount of products that we will require. Then morbidity data is used to understand what is the magnitude or the burden of disease in a certain population, in a certain geography. We can also use disease burden data to conduct forecasting, and we will look how in this session. Quickly moving on, let's start with the scenario. So this is the basic scenario, basic of the fictitious geography that we have created for these scenarios. This is district X. I don't know, this map maybe may represent some country somewhere, maybe a small island, but this is for this purpose, for this exercise purpose, it's a fictitious island or a district. It has a population of 200,000, growing at 3.2% annually, has 5 sub-districts. It fully imports all of its products, and it has a national supply organization working under Ministry of Health. Okay, so this is just a basic background of the scenario. Moving on, the first scenario that we have a product, ciprofloxacin tablet. I'm sure all of you know what ciprofloxacin is. It's an antibiotic. It says it's used for the indication of typhoid, diarrhea, infections of lower respiratory tract. It is part of Essential Medicines Program, which is managed by the Ministry of Health, by the National Supply Organization, funded by the Drug Revolving Fund. It's available in pack sizes 10 strips by 10 strips in a 10 tablets in 10 strips in a secondary pack, which means 100 tablets in a secondary pack, and the forecast period is 12 months. We need to forecast the commodity using a simple average monthly consumption calculation. Okay, I hope many of you have used average monthly consumption in your professional life. So we will be using those average monthly consumption calculation for this scenario. I hope all of you can see my screen. Now I have the Excel sheet here. Let me increase the size so that it's visible. So again, the same scenario is provided here. Okay, here you see there's a period of 24 months, which is the past period, the data that we have. Okay, and based on this past consumption data of 24 months, we need to calculate determine the forecast for the next 12 months. Okay, now here we have the consumption data available in form of number of tablets. So this is not in form of number of packs, but it is in the form of number of tablets. Okay, and then we need to calculate determine the forecast for 12 months. So it's a very simple calculation that we will use. Average monthly consumption. To determine average monthly consumption, what we do is we take the sum of the consumption of all the period that is available with us, in this case 24 months, and we divide it by the number of period. That's how we get the average monthly consumption. So this is the formula written here: sum of quantities consumed divided by number of period. Okay, so what we will do is we will take the sum of all the quantities consumed in the previous 24 months, and then we will divide it by 24. But then in the next period, there will be some form of population growth probably. And in forecasts, we take these assumptions so that even if, there is a population increase or there are more patients, we take them into account. So if, let's say, we need to adjust for the population increase or the growth rate, we can add that growth rate percentage into our AMC as well. And then based on that, we will determine the forecast. Now to start this entire exercise, what we will do is, first of all, we will convert the number of tablets into the unit of measure. Now in this case, unit of measure is 100 tablets in one pack. Okay, so one pack is equal to 100 tablets. So what we will do is we will divide this number by 100. Okay, this will give us the number of packs which were dispensed in that period in January. Okay, since we're using Excel, I hope you know there's a drag and drop function. So I will use that to calculate it for all the other months. So we have the pack size calculated for all the other months. And here we have the sum of all the pack sizes. So the way we do it is we use the syntax sum and we calculate all these cells. Okay. So 2139 is the sum of all these consumed packs in the last 24 months. And you will see here it comes as well, 2139. Here's the same function applied here. And then number of period is 24. So in this cell, the formula is applied, this number sum divided by 24. So we get 89. So the average monthly consumption is 89 packs. So it's not in tablets, but in packs because this is our unit of measure. Now we adjusted it for the any population growth or any extra requirement that we may see. And there can be other assumptions as well, depending on the program that you're looking at. Okay. And in that way, you can increase or decrease your average monthly consumptions. In this case, we just added, if you see here, 3.2% into 89, and that's how we got 92. So the adjusted average monthly consumption is 92, which we will use to develop the forecast for the next period. The next period is 12 months. So what we will do is we will multiply 92 with 12. So 92 is in cell number K25 and we multiply it with 12. So I will just also do a simple calculation where you find it easier. 92 multiplied by 12. We have 1104 packs. And if you want to see it in tablets, you can multiply it with 100. So you get 110,400 tablets required for next 12 months. Okay. So this is a very simple calculation to do a very simple forecast using average monthly consumption. Let me quickly go back to the slideshow. So if you see here, average monthly consumptions are useful when you are forecasting commodity needs at a facility level. Now at a facility, you would know your consumption in the past months. You can determine your average monthly consumption and you can multiply it with the next period. Ideally, you should use AMC calculations when you have at least 12 to 24 months of data. There are many places where they also determine average monthly consumption by just taking an average of, let's say, 3 months. But for various products, data of 3 months may not be enough. It may not be enough to represent the entire consumption during a year, because there may be some seasonal variations, there may be some other issues which you may not able to cover in those 3 months. So it's always good to have more data set when you are taking averages. Okay. You can also use AMC calculations to understand how much of stock you have available in your facility or warehouse. So for example, whatever amount of packs you have available, you can divide it by your average monthly consumption and you will know the amount of months that your stock may last. Okay. And of course, if your consumption is mostly steady, it can be useful during that time. Pierre, you have raised your hand. Please, you can speak at this point. Over to you.
Thank you, Sanjay. Can you hear me?
Yes, absolutely.
So I know the answer, but I just wanted to introduce some complexities in your slide and your thinking is, imagine that you're doing the forecasting of bed nets. When there's a campaign, would you still use the average, the AMC? How would you compensate for a campaign or seasonality in your computation? Back to you.
Yeah, I mean, for when you have different campaigns, it's not advisable, because then there is a scenario that you have developed, because different campaigns have different targets. Now it's good to understand how much the consumption was in the previous months, which you can try to find the averages of. But in a campaign, your targets will be different. You will be trying to reach more people, and so it's easy to understand that whatever average consumption that you were seeing in the past months, probably your consumption may be higher because of your renewed targets in a campaign. So probably in campaign mode, it is much more advisable to use scenario mode of forecasting rather than using past consumption data, if that's the kind of question you were trying to ask, Pierre. Romeo, you have your hand raised. Please, you can also speak at this point.
Okay, can you hear me?
Yes, Romeo, by the time you're talking, Andrea, can you also put this poll on screen? Romeo, please, over to you.
All right, thanks. Well, a couple of questions. One is for you, Sanjay. Well, both of them actually. Well, the first is if how many months do we have to wait until we start measuring the average monthly consumption? I hear that we can start off about when we reach at least 3 months consecutively months on the road. And the second one is what we have to do when those numbers are not what we regularly have as an average, meaning that maybe it's a different context, it's an outbreak context, or there are some scenarios that are not having the regular consumption that we've been looking at before.
Okay, 3 months is the bare minimum, first of all. Okay, I mean, for any average for that matter, if you're using averages, 3 is the bare minimum number, because you can't really look at an average with instances, right? So 3 is the bare minimum, but it is advisable if you are creating forecasts for a longer period. Let's say you are just doing a forecast for 1 month, right? Then you can take an average monthly consumption of 3 months. That's okay. So that is more or less saying that you're taking a moving average. I don't know how much familiar you are with moving averages. That's what it's kind of like a moving average when you take 3 months average and you use it as a forecast for the next month. But if you have to do a forecast for a longer period of time, let's say 12 months, then it is advisable to at least take 12 months or a bigger set of data, right? So that's your first question. The next question you asked is how would it be different if there is an outbreak, and it's a very similar question like Pierre. Pierre has raised his hand as well. Pierre, are you trying to answer his question, or there is a new question?
No. Go ahead. I would like to give more context to what you suggested.
Sure. In those scenarios when there is an outbreak, or again, it's a different kind of scenario. Again, like I said, you use scenario mode of quantification forecasting. In those cases, you don't use the consumption in the previous months, because in a case of outbreak, you know that your consumption may well be higher than your average in the previous 6, 10, 12 months. Okay. So in those cases, you create a scenario. You try to understand the magnitude of outbreak. You try to understand how many people are affected. You try to understand what are the products that you require to curb that outbreak. And then you use your treatment regimens to conduct your forecast. And that's a complicated method. I mean, if you want to do it right, that's a complicated method. And many places we have seen, we don't use comprehensive methods because they're complicated. So we take AMCs and then we add some percentages to it. Okay. But in these scenarios, we need to really create those scenarios and try to build our forecast according to those scenarios. Pierre, over to you quickly. Then we move on to the next scenario.
Yes. My suggestion for you all, and Romeo specifically, is that I'm sharing my experience. I was managing 7 million vaccines in British Columbia in Canada. And then it was very hard. And what I learned in the process is that it will be ideal when you have, for example, 24 months of data, is to study them and to see if there is an outbreak or something that is bizarre. If it's bizarre, then you segregate and you keep one column which is routine consumption, and another column which is something that is bizarre. Is it an outbreak? Is it a promotion, a campaign, something somewhere? But you need to confirm that with the people who were there, who could confirm, yes, it was a campaign, yes, it was an outbreak. Then you separate, you create two columns so that you're able actually to sophisticate your thinking instead of taking a blind average.
Yeah.
Back to you, Sanjay.
Thank you, Pierre. Rahul, I see your hand raised as well. Can you put your question in the chat because we are a bit short of time today. I hope people won't mind if we just take additional 10 minutes to end this session. But Rahul, please put your question in the chat and we will get back to you on that. I hope you can see the polls on your screen. Please do vote on the polls. Let me move on to the next scenario. And if you have any questions, put them in the chat. We will get to you on those questions. The next scenario is with services data. Here, again, the product is medroxyprogesterone injection. It is available in 24 syringes in one pack. It's a contraception. It's a product for contraception, and the regimen is that one injection is required every 3 months. Okay, it's under the family planning product, and the Ministry of Health has asked the National Supply Organization and the district to substitute this product against the oral contraceptive because this product has proven to be more effective. Now, the Ministry of Health has given a target that at least 60% of women who were on oral contraceptives must be transitioned to this product. Now, we need to create a forecast for 12 months using services data and the program target that has been given by the Ministry of Health. Now, before we do that, I would like to ask you what you know about CYP factor. Now, I believe you have learned this in the modules as well, but let me talk about CYP factor a bit here before we go on to the Excel. CYP is couple year of protection. Here, couple means a male and a female, husband and a wife, partners. Okay, couple doesn't mean, I mean, not necessarily two in this case, not 2 years of protection, but a couple. So CYP is a measure that estimates protection from pregnancy provided by contraceptive methods. So different contraceptive methods provide protection in various ways. So for example, if a woman is taking oral contraceptive pills, then 15 pill cycles are required to provide one CYP, which means 15 sets of pills or whatever that unit of measure is are required throughout a 1 year period. In terms of condoms, it's 120. So which means that in 1 year, in 12 months, a couple would need 120 condoms to ensure that there is contraception in place. Okay, so that's kind of you can say it's a kind of a treatment regimen, or you can say a standard applicable number to let us know that how much of these products are required over a year to ensure contraception. Okay, so we will use this number in this scenario as well. Now let me move on to the Excel very quickly. So like you see here, the scenario is provided here. We have 12 months data of all the women who attended the clinics for oral contraceptives. Okay, so we have the services data for all the women who attended the clinics. We also know that the women aged between 15 and 49 are 60,000. So that's the number of women who would require contraception. Okay. Now, in this case, what we are going to do is, first of all, we will calculate the total number of women who are actually on oral contraceptive under the facilities in District X. So that's the first thing we will do. Then we will try to find out what does the program target look like. Now, the Ministry of Health said 60% of all women who are on oral contraceptive must be given this particular product. And then they also said that there needs to be more advocacy in the district. Now, we believe that with advocacy, 10% of users will automatically come into this product substitution. So we're taking an assumption that apart from the 60% of women that the facilities will mandatorily switch over to this new product, there will be 10% new users based on the advocacy efforts that the district is going to do. Based on that, we will find out a total number that are going to use the new product, and then we will use the CYP factor. Now, in this case, the CYP factor is 4. Now, if you see here, the injection is required every 3 months. So, which means in 1 year time, 4 injections are required for contraception. Okay, so that's why the CYP number is 4. Now, based on that, we'll calculate total number of injections and then the number of packs. Okay, we also know that in one pack there are 24 injections. So let us do this calculation. Again, we will use the sum of all this. So to determine how many women went to the clinics for oral contraceptives. So these many number of women. Now the program target is 60% of existing women. So 60% of this number, we got 15,000 women who there is a mandate to be switched over to this contraception. Then we also took an assumption that 10% new users can be there because of advocacy. So we do 10% multiplied by what? Multiplied by 60,000, because that's the overall number of women who are there in District X who may require contraception. Okay. So we have 6,000. We assume that there will be more 6,000 more women who would come under this new treatment regimen. So in total, 15,000 plus 6,000, we have 21,070 women. Okay, we use the sum function here as well. Now the CYP factor is 4. Now as we put the number 4 in this cell, if we multiply 21,000 by 4, we have 84,278 number of injection. And if we need to calculate the number of packs, we divide this number by 24. So as we divide it by 24, we get the number of packs we require for 1 year. So the assumptions can be different, the program targets can be different, and based on that, your numbers can be entirely different. Okay. There's another point here. Now, we don't have the data here as to how many women are in different age categories, like how many women are 15 to 18, for example, how many women are 19 to 25 or 30 or whatever. The reason why I'm talking about this is there may be some women who at the time you are doing this forecasting are not at the age where they require contraception. But by the time your program starts, there may be some women who are not in this data set who may come in the age where they would require contraception. Okay, so you can also take some standard assumptions based on your annual growth rates or some kind of formula that you use in your countries, or you may not want to do it because you think this would be sufficient because your advocacy efforts are not going to be that much. So it really depends on assumptions in forecasts. But whatever assumptions that you take, you need to document them very carefully so that you know that in this particular forecast, we took these assumptions and some of these assumptions were right and some of these assumptions were wrong. Okay, so that the next time you do it, you have better idea of how to take those assumptions in the next period. Okay.
I think Pierre has a question.
Okay, so let me quickly go back to the slides and then I'm also answering some of the questions that I'm seeing. Tadele is asking, what if there are different methods, choices of contraceptives in the country? Yes, absolutely. Now again, like I said, in this particular case, there was a mandate from the ministry to put people on this product. This is a product substitution. Okay. In general, there are different contraceptive methods which are used. So you need to calculate, you need to forecast for different contraceptive methods. So it has to be done one by one, trying to understand what is the prevalence of contraceptive methods, one contraceptive method over the other. Are there any program targets available? And what were the consumptions of those different contraceptives in the previous period as well. So this is just one example trying to show you how we can do forecasting using services data and CYP factor. But in ideal scenarios, you will have 10 different contraceptives. People have different choices of those contraceptives. You would also look at the consumption data. You will also look at the prevalence of choices and then make your decision. Okay, Pierre, do you have a question? Did you raise your hand?
No, that's fine. Sorry.
Okay. All right. Now, moving on. In this case, there was no consumption data since it was a new product. Now, you may also ask that, okay, but why can't we take the consumption of a similar product, which was being consumed? The reason being, you're not taking consumption data of a similar product because the product specifications are different. You can't compare tablets against injectables. Okay. And even if somehow there were two tablets, they may have different packaging specifications as well. Okay. So it's not always advisable to take consumption of a different product to forecast another product, but you can use them as a proxy to validate your assumptions as well. So you're not using them to develop forecasts, but you're using them to validate your forecast to understand how close or far, or like Pierre said briefly previously, if your forecast look bizarre or not, if it looks close to reality or not. Okay, so you can use those scenarios as well. A challenge in this scenario was there was no supply data as well, because it was a new product. So it was an entirely new product and you wanted to forecast how much do you think you would need. So that's why we were using services data as to number of consumers or patients, and a CYP factor, which is like a treatment regimen. Okay. Moving on to the third scenario. Again, please, if you have questions, put them on chat. I will try to answer them, as I see them. In the scenario 3, we will be using demographic and surveillance data. This is trying to show you different data sets and different methods, because again, most places we use consumption data, and you also said most places you use consumption data. But why are we talking about other methods? So that if someday consumption data is not available, you still know the concepts of how to use different data sets. Okay. In this case, we have anti-malarial product. It's a national malaria program, artemether lumefantrine AL ACT product. Okay, it has various pack sizes, but it has a 3-day regimen depending on age. Again, this is a product substitution. It's a treatment substitution. There is a mandate by the Ministry of Health in District X to put people from monotherapies to combinational therapies. I hope you understand the difference between monotherapies and combinational therapy. This is a combinational therapy that we're talking about. Although in most places right now we have combinational therapy, but just for you to understand how to use demographic and surveillance data, I've taken this example. Again, a forecast for 12 months. Okay. So let me quickly go to the Excel. Let me just check. Yeah. So again, in this case, there are two challenges. There is no consumption data because this is a new product substitution. There is no supply data as well. So we will use demographic data and surveillance data. We go to forecast 3. Again, let me increase the size so that you see it better. You see here, this is the regimen. So it's a 3-day regimen for up to different ages, different number of tablets in 1 day. For up to 3 years of age, 2 tablets per day. For adults, 12 and above, 8 tablets per day. In a total of 24 tablets at max and 6 tablets minimum. There are different pack sizes as well for different treatment regimens. So the pack sizes also come in 180 tablets and 720 tablets as well. Okay, the secondary pack. All right. So to do this forecast, we need to use demographic data. What do we mean by demographic data? We mean how many people are there. Okay, and we also have this data in different categories: 0 to 3 years, 3 to 8 years, 8 to 12 years. We also have total number of population. We also have surveillance data, which says that annual malaria incidence is 18%. Okay, and in children it is 7%. So 7% of children are affected annually, and in total it is 18%. So which means that for adults it is 11%, because the rest of, if you minus 7 from 18, which means 11% is the incidence rate in adults. Okay, which is in this case 12 and above. Okay, so what we will do is we will understand different incidence rate in different categories of the population that we're using, and then we will use the treatment regimen to understand the number of products that we need. Okay, so to start with, first of all, we put this table, complete this table. We have 200,000 total population of district X. Number of children 0 to 3 is 18,000, 3 to 8 25,000, and children 8 to 12 is 6,700. So the remaining 12 and above is 200,000 minus I think I did it right. Yeah. So we have 12 and above, we have 150,000 people, okay, which we will use for this calculation. Now, like I said, 11% is the incidence for adults, 12 and above, and for children it is 7%. Now the data doesn't say that what is the distribution amongst the children, which is 0 to 3, 3 to 8, 8 to 12. So what we will do is we'll take the assumption that for different categories, the incidence rate is same, which is 7%. Okay. So based on the incidence rates and the number of population, let us find out our target population who can be patients of malaria in the next forecasting period. So in adults, we have 11%. So 11% multiplied by, we'll take this, says C39, I don't see which is C39, which is okay. 11% multiplied by this number, we have 16,533. And then we will do in children, which is 7% multiplied by this number, the total of this number. Okay, we'll also do this just to see, just to validate our forecast as well. So plus this.
Be careful, plus. It's 7%, not 7.
Yeah. Okay, so total in adults and total in children. Okay, now we have total of existing population, 20,012 prospective patients in total. Now again, we also know that we have a growth rate of 3.2%. So in the next year, we will have new infants, which is not covered in this data currently. So we will also take incidence for new births, which is 7% multiplied by 3.2% into the total population. Okay, so I'll just put it here, 200,000. So we have 448, we may have 448 cases in the next period because of the growth rate. So in total, we have 20,460 patients who could get malaria in the next period. Now here we have 4 different tables, forecasting of quantities based on the treatment regimens. 12 and above, 0 to 3 years, 3 to 8, 8 to 12. So to do 12 and above, what we will do is multiply. First of all, we'll see what is 12 and above, which is 16,533, which we calculated here. we know that the treatment regimen is 24 tablets here. If you see here 12 and above, we need 24 tablets. We multiply this with 24 tablets, we get 396, 792. And if we divide it with 720, which is the pack size, we get 551 pack sizes for this treatment regimen required for 12 and above, which is adults. Similarly, for infants, number of patients, we do same. We can either find the incidence here directly, or we can do it directly here, which is 7% of infant population which we have here, 18,000, plus the growth rate. Okay, so if we take 7% of both, we will get 1,708 patients. Treatment regimen is 6 tablets only. Multiply total tablets and then divide by 180, we get the secondary pack. Similarly, for 3 to 8 and 8 to 12, we calculate number of prospective patient. Treatment regimen is different, 12, multiply and then divide by this number, 540, or rather not 540, 360. And then same 8 to 12, we do the same calculation and divide by 540. Okay, so this way we get the number of packs required for different treatment regimen and different pack sizes. So you can say that total number of AL required in tablets, if you add these numbers, it says that 436,482 tablets are required. But the issue is that in this case, tablets come in different pack sizes. Okay, so you also need to take into account the pack sizes, and that's why always when you're doing forecasting, it is important what is the unit of measure for supply chain. You are not going to distribute the tablets in tablets form in itself. You're going to distribute packs, you're going to distribute cartons. So we need to look at those packs which you are actually distributing from central warehouse to your facility, or whenever it comes from manufacturers to your central warehouse as well. So that's why we're using packs as a unit of measure for forecasting, and as a standard rule, you always use packs, secondary packs, as a unit of measure, whether it is a box of 100 tablets, one bottle, sometimes it's a pre-filled injections, but one pack of injections, and similar specifications. Romeo, you have your hand raised. One question we'll take, and then we'll go on to the next scenario, which is the last scenario. Over to you.
Thanks, Sanjay. I just want to know, can you repeat the steps where, how do you calculate the people more than 12 years?
More than 12 years?
Yeah, how do you get the 150,000, please?
Yeah, so total population is 200,000, right?
Correct.
We have number of children available, 0 to 3, 3 to 8, 8 to 12. So whatever is left is 12 and above. Is that correct?
So that's just B27 minus 28, 29, and 30, right?
30, exactly.
Okay, I think I got something different then, but I'm not sure.
Okay, if we use this calculation, even then we get this. So yeah.
Okay, got it.
Yeah.
Thank you.
Let me see, there's a comment in chat. Can we take incidence of mortality into cognizance in times of forecasting, knowing that disease prevalence or epidemic can hit the community, hence reducing the population to the aforementioned forecasted consumption? I mean, generally we don't take incidence of mortality, because because we don't want people to die. We need to know how many people are sick who would need the medicine. Now, I'm not sure if I understand the question correctly. Maybe you want to speak, Audu, to make your question much more clearer. I don't know why my camera is also off. Audu, do you want to speak? Okay, maybe not. There was another question here in chat. Pierre, you have your hand raised. You can speak by the time I look at this.
Okay, question. If the forecast says for one type of category of people or patients, we need 49 packs and 50 packs equal 1 carton. Do you think it's advisable to prolong the thinking of the person quantifying, saying, well, think about the next unit of measure and what is it a big deal to purchase 1 pack more to have a full carton? Back to you, Sanjay.
Yeah, that's why we do the rounding off eventually. Of course, we need to also understand when we, okay, so sorry, let me rephrase, let me go back. We need to first of all determine at what level we are doing the forecast. Okay, if you're doing the forecast at a facility, then we need to determine the forecasts in absolute number of packs. Then we don't want the other level to send you a pack which ideally should have 10 strips but have 5. Okay, in ideal conditions all the packs should be complete. Okay, that's how generally we also save money in transportation when we have complete boxes, number one. Number two, if we are doing the forecast at a higher level, then we need to understand in terms of cartons. It depends on where we are, and then we also need to know how much would a carton contain, how many number of secondary boxes would a carton contain, and hence we then have to round up or round down in some cases our forecast to make sure that we are always ordering full packs or full cartons. We're not ordering like 1.5, 1.25, because that's a hassle for the manufacturer. That's a hassle for a central medical store to send to a new level, so the next level, and for everyone else. I hope that was your question, Pierre.
Yes, thank you.
Kenfrey asked, have you been told all the women who attended the FP clinic monthly were issued with 1 year of oral contraceptive? Because if they were each issued with only a month of oral contraceptive, would using a CYP of 4 be right? Very good question, Kenfrey. Again, this is an hypothetical data where we are looking at 1 year of data. Okay, we know that all those women were given 1 full year of contraceptive. In reality, that may not be the case, and that's why we need to look at our services data very carefully. Now, in any clinic that you go with services data, you would also know how much of medicine was given to that particular patient. So that's why initially I said consumption data should ideally match your services data. So if for full contraception, a woman who's on oral contraceptive should come to a clinic once every month. That means once every month, her quota of oral contraceptives must be fulfilled. Now, when you look at the data, if those numbers were not fulfilled, then you know how much of contraception was given to that particular woman. Now, when you're doing the forecasting, you are not doing it for 3/4 of an year. You're doing it for full year. You will still take CYP of 4 because your forecast is for a period of 12 months. Okay. And even if some women join the contraceptive scheme in the middle of the year, you would assume that there would be more women in the next period who would want to come into the contraceptive program. Okay, so CYPs you would also always take for 1 year because you want to you want to conduct the program for 1 full year. You don't want to do the program for 2 months or 3/4 or 2/4. Okay, if that makes sense for your question. Now, finally, moving on to the last scenario that we have. In this case, I'll quickly show you this. This is again the same product from scenario 1, but here, Romeo, you raised your hand. I will come back to you in a bit once I complete this scenario. In this scenario, it's the same product, same target, same everything, except we're not using average monthly consumption, but we are using something called a trend function in the Excel. Okay, so I will quickly take you to the Excel. So now you see here, again, same 24 months data. First of all, we need to figure out number of packs. Okay, so let me quickly derive the number of packs. Then we need to use the trend function. Now in trend function, what we try to do is, first of all, try to establish a trend in the given data. In the given data that we have a period of 24 months, and we have consumption according to those months, okay, for 24 months. So when we identify a trend, we try to understand, what is the trend looks like. Is it going upward? Is it going downward? Is it static? So this is what we will do here. First, we will identify the trend for this 24 months, and then to determine the forecast for next 12 months, we will extrapolate that trend, taking into assumption that whatever scenario was there in these 24 months, it is going to remain the same. Once you determine the forecast using the trend function, if there were some assumptions you want to take, then you can add into that forecast as well. If those assumptions are beyond some of the parameters which is within these 24 months. So for example, sometimes when you do extrapolation, you want to take seasonalities into account. For example, in malaria, if you're doing malaria is more common during rainy periods. So there is a seasonality factor. And then in other diseases, there can be other variations in consumption during a specific duration in a year. Okay, so you can take those things into account. Now, to do a simple trend calculation, we use the trend function. Okay, but to do that, first we'll select this entire 24 months period, and then we will use trend. If you see in Excel, it says put your known y's and put your known x's. Okay, so that way we will understand the trend for these 24 months. So if you see this graph here, on the y we have our consumption, and on the x we have our timeline. So I will select for the known y's the entire consumption for 24 months. Then I will select the period here, and then I will close the bracket and hit enter. And if you see here, this is the trend that comes here. Let me remove this line from here. This is misrepresenting. So this is the trend for this particular period. Okay. Now let me put all of this into the graph. So I will select these numbers. And then I will insert them into a line graph. This is the correct one. Let me remove this. So if you see here, this blue line represents the consumption that we see from the last 24 months, and it is zigzag. It is up and down. It's going down, it's going up, and then down. And this particular trend that we see, it is slightly in an upward direction. Okay. This is like to say that in totality, this is the kind of trend that we are seeing for this particular period of 24 months for this particular product. Okay. Now what we're going to do is we're using this trend function to extrapolate for these 12 months to know what could be the product demand in the next 12 months. Okay. To do that, what we can do is we can simply select this. Okay. Then use the trend function again. So again, the known y's. So for us, the known y's are this: consumption, Our known x's are the months. Now in this case, we'll select all these months. Sorry, we'll select this. Then we have the new x's, which is these. Okay, and then we'll put a constant. We don't need to put a constant, and we'll put enter. So what did we do? What we did was we used this as a precursor to this period, and based on this data, we extrapolated this trend into the next 12 months. Okay, so this is the extrapolation of the next 12 months, and if we calculate this into a number of packs, this comes out to be around 1122 packs for the next 12 months. Now we can also extrapolate this in this graph as well. To do that, we just need to select the data. Okay, let me do like this. Let me select the entire period. Okay, I did something wrong. Sometimes my Excel skills are not that good. Yeah. Okay. Okay, let me do it from the beginning. I'm so sorry. Let me select this. All right, I'm doing something wrong, but what I wanted to show you was the extrapolation of the data on the graph as well. But sometimes I struggle with Excel as well because I'm not an Excel expert. But anyways, let me go back to the previous chart, which was correct. Yeah. So what I'm trying to show you here is the line extrapolated to the next 12 months, which is trying to show you the upward trend of this data. And based on this, we calculated the number of packs, for which is required for the next period. So this is a simple method of using trend to calculate your forecasts. Okay, he's asking how you inserted the trend function. Okay, that I can do very quickly. Let me delete everything again. So what we can do is we put trend. There are three things we need to look at: known y's, y-axis. So that's why I was showing you the graph so that we know what is the axis and what is the data represented at different axes. So this is the y-axis. In the y-axis, we have the consumption data. In the x-axis, we have the timeline. So the known y's is the data that we already have in packs. Known x's is the period that we want to plot it against, which is the timeline here. Okay. Then the new x. If we want to extrapolate our trend, then we identify this new x and we finish the bracket and we enter and we get this trend function. But actually before this, what we need to do is we need to select all the cells where we want the data to be put in. So we want the trend to extrapolate the data from cell number 1, which is this first month, to the last cell here, 36 number cell, which is December. Okay, and that's when we need to use the trend function, known y's.
I think you can. I think you can use. You can use a formula from the cell F40 downstream.
Yeah, we can also use that. Absolutely. But I also want to show you the trend in if we need to plot the trend in the existing period as well. Okay.
All right.
Okay, I did something wrong. Yeah, sorry, this is going to be here actually. Yeah, so this is the formula that we're using, okay, to extrapolate our data. So the other way of looking at the formula is you can also use the insert function option here. So for example, if you're using this, you can just do insert function and use the trend here. And then you see known y's, known x's. And if you just want to plot the trend in your existing data, then just use these two options. And then if you want to extrapolate, then use the new x's. Okay. So we already have the template. When I send you the new document with the data which is already plotted in, you can look at the data over there as well. Okay.
Sorry, Sanjay. What is the constant data that you're using? The last part of the formula?
So generally, constant we use 0 or 1.
Oh, 0 or 1. Okay.
Yeah, 0 or 1. But generally, if you also don't use the constant, it's also okay. Okay. So again, I'm showing you very simple calculations here. I'm not a Excel expert. For very extensive analysis, you also need proper statistical analysis of these data sets as well. Okay, Pierre, over to you. You want to say something while I show them the next section?
Yeah, my suggestion is not to plot that on a straight timeline, but to add to have the years on the same graph, so that we're able to compare one year to the other, and the seasonality as well. Seasonality is very important.
Yeah. Of course, I mean, again, these are hypothetical data pair. So if we don't want to show too much of data analysis in this session because sometimes it gets very advanced. So like I said, these are simple calculations for you to understand very simply how to extrapolate some data to understand, if you're doing the right, if you're taking the right steps or not. Okay. But yes.
Can I add something, Sanjay?
Yeah, please go on.
So
Andrea, can you launch the poll? Yeah.
Yes.
Go on, please.
So as an external guest speaker, I would say the conclusion of these scenarios is that there's two options. Basically, you do the forecast in your ivory tower, and you do your own stuff without talking to anybody.
Yeah.
And then most likely you will not stick to the reality. The other option is actually to talk to people. To talk to people who knows most likely what will happen. If it's an introduction of a new product, then you will have, it's always exponential. So the beginning is very shy. If you take another methodology than consumption, then you will have to talk to the programmatic people. They will tell you if the assumptions are good, if the population is good, or they will give you so much subtlety. And so thanks to that, you will have better forecasting for the first year. And when you have to do the exercise again for the year after, you will see how much you will have learned in the process, and you will be able to fine-tune even more. So communication is actually key in forecasting. You cannot forecast in your ivory tower. Back to you, Sanjay.
Yeah, absolutely. Again, the idea of showing you these different scenarios and different data sets and methods is to tell you that you don't always have to use consumption data. Okay. And sometimes consumption data is also giving you some wrong ideas about, what is the actual forecast. And sometimes consumption data is also not available. You're using distribution data, you're using supplies data, and that gives you even a worse picture than what is actually happening on the ground. And that's when you need to try and collect other data sets, which I know is difficult. Like you see on the slide, why don't we use more of services data, demographic data, or surveillance data sets? Because they're difficult to collect. They're not always available to you as well as a supply chain organization, but to have a better forecast over a long period of time, you need to triangulate your forecasts with different sets of data and not always use consumption data. It can be hectic. It can be really challenging collecting those data, putting them in a logical manner in a data analysis tool and trying to forecast, and sometimes with the different donors, different programs, it is not always possible. But it is actually much easier to do at a facility level than at a national level. So at a facility, if you know what is your product demand and each facility do that by themselves, and you give those forecasts at your higher level, or the data sets, right data sets to your higher level, that's when it becomes much easier for people to conduct those forecasts and come to a logical conclusion of what is required for the next period. And yes, Barbara, we will be sharing these recordings on the Hive as well, as usual. Yeah, they're also available on YouTube. Although this session is going very long, I apologize for that. We wanted to finish it much sooner. But last section, which I will try to cover very quickly, is about the accuracy and error rates. Now, like Pierre was mentioning before some time, that forecasts are never accurate. Accuracy rate may vary, and you've seen that, you've seen a lot of stockouts, you've seen a lot of expiries, and that's because your forecasting was not accurate. So over a period of time, how do we monitor that forecast? We need to get the actual data and we need to compare it against our forecasts. Okay. So we do it using simple error methods. So here, first of all, what we will do is we will compare different forecasts that we developed, one using AMC. So we had the, before that, we're still using the same product, ciprofloxacin. In the first scenario, we calculated the AMC as 92. So we will put this 92 in all the cells. And then in the forecast 4, we had this as a forecast which came to us, which we will put here. Okay. So as we put this here, you will see that the total number of packs required are different. In this case, this is 1104, and in this case it's 1122, although we are still using the same data sets. Now I've just created a fictional data set again for the actual consumption, and it can be anything. I've just put it here just to show you how we do the calculations. Okay, so this is the actual consumption which at a later stage we collected from the facilities and plotted it here. Okay, now there are 3 different error rates method that we use. One is called mean absolute deviation, which is the absolute number. And then we have mean squared error, which is the square of the absolute number that we will calculate. And the third is in percentage. Okay, so mean absolute deviation is the absolute number of error that we see amongst the numbers. We square them to identify in which cases our error was much higher. So the square actually kind of gives more weight to those places where the error rate was higher. And then percentage we use when we want to tell our managers or anyone, okay, what is the error rate? Okay, it's 4%, rather than saying that we were off by 500 packs, for example, but we don't know the denominator 500 packs of how much. Okay, so that's when we use percentage. So let's start. There is a function called absolute ABS. Okay, we will use that ABS. So this is the actual consumption. We'll subtract this by the forecast, and we're using first the AMC. So this was the error rate. Okay, let me just extrapolate it. We have the absolute error rates here. And I will take the average of these error rates, okay, which will give us the mean absolute deviation. So I've taken average of this, okay, these cells from I14 to I25, okay, which gives me mean absolute deviation. Now if I need to square it, so I will just square this let me find where it is. Square. Okay, so this is the square of this cell. So error of this month, January, if you square it, it is 16. We'll again drag and drop. And here the mean squared error again, average of this is 49.42. To take the percentage, we divide the mean absolute, okay, mean absolute, which is 4 in this case, by the actual consumption. Okay, so this is the error divided by the actual consumption, we get the percentage. And as I drag and drop this as well, and then take the mean, it gives me mean absolute percentage error. So which means that for this data calculated using AMC, the overall error in percentage terms was 6% or 6.19%. Now, if we do the same for the values we got from the trend function, again we use the same ABS, this minus this. Okay, I hope yeah. And then I extrapolate this, and then the mean, which is average here, I take the average of all of this, and I get 5.2. Same, I square it up, I get an error 38.04. And if I take the percent, I get 5.55. Now for this fictitious case, the error rate using the trend function was less, than when we use the AMC function. It can be different as well. You may also get better results with AMC, and it really depends how you did it, and sometimes you get lucky as well. But the more important thing is that you need to track the error rates when you get the actual consumption data from the facility, and you should not wait until the end of period to do this. As soon as you are, let's say you can do this quarterly, so as soon as you are past March, in April you should get the quarterly data from the facilities and start calculating your error rates, so that by the end of the year you know how much was your forecasting off, or maybe it was good, maybe it was bad. So you need to do this continuously. So for example, in Ethiopia, they have, in IPSA, they have a dedicated quantification department. Now quantification is done annually or once in 2 years. So when quantification is not being done, those people should be doing this. They should be monitoring their forecasting error. They should be monitoring difference between actual consumption and forecasts. And in general, in facilities, you can do that. You create your forecasts, you submit it, and then you monitor how far your forecasts were off from the actual data. Okay, so I will just stop this, and Romeo has raised his hand. Romeo, you can go ahead, and there is something in chat.
Thanks, Sanjay. Can you just repeat again how do you calculate the square formula, and the one that the MAPE as well, please?
Okay, so to calculate the mean absolute deviation, we use a formula called ABS, absolute. Okay, so it simply is, you don't need to use the formula as well. What you need to do is subtract your forecast from the actual consumption. So 88 minus 92 is minus 4. The reason I used ABS, absolute, so that it gives me the result in positive values.
Correct.
If I have negative and positive values here, if I take the average, it won't come to the same result, right? So that's why I use the term, use the function ABS, so that all the results are in positive. Okay, number one. Number two, when we are squaring this, there is a small, this.
Oh, gotcha.
This is in a square.
Square symbol.
Yeah.
Yeah.
And then of course I'm doing square, so I multiply with 2. If I was doing cube, I will do 3. It will be cube, but I'm doing square.
Okay. Good. All right.
Yeah. So this is how I did it, and then this is on top is the average.
Okay.
This is the average here, and then percentage, divide your error by the actual consumption.
EF divided between F. Okay. Yeah. I between F. Got it. Thanks.
Yeah. Any other questions? Please, this was the last scenario that we have. And I will go back to the PowerPoint now. Again, here I also show a bit more about MAD, MSE, MAPE, what are different error rates and how you calculate them. Again, finally, this is the end of the session. There's Q&A and there's a rating poll as well, which I would ask Andrea to launch. Andrea, I'm giving you host. Okay, if there are any other questions, please ask them. I know it's late, and if there are any other questions you want to send us on our email, please do send us. We will put them in the Hive community as well. Okay, I want to thank Pierre for joining us in this session. Andrea, have you launched the poll? Yeah, please also rate us how you like this session. I know it gets a little bit overwhelming when we use Excel. We are not very well versed with Excel because we are in the health department, but I encourage everyone to learn a bit more statistics. I've tried my best, but when I'm under the pump, sometimes I make mistakes in Excel. Okay, so yeah, it's a tough job, forecasting. It's a thankless job. You make your best effort, but most times forecastings are wrong. Pierre was telling me one instance when his forecasts were only 6% accurate, and that too for a multi-billion-dollar operation. And it happens, and that's why you need to keep monitoring your forecasts. That's why error rates are important, so that you know how you can improve your forecast in the long run. Okay, for any new program, forecasts are supposed to be wrong. Okay, but over a period of time, if your forecasts are wrong, then there is something wrong in the process. So the first thing, make sure you have a right process, right method, and then you follow the right approach, data sets, and the quality of data must also be good. Andrea, did you get responses on the final poll?
Oh yes, yeah, the poll is done.
All well. Did I bore them to death, or it was all good?
No, it seems that it's all good.
Okay, great. We'll send you the recording on your emails as well, and we'll put it on the YouTube and the Hive as well. So please go through that, and then the Excel sheets you already have. I will send you the filled Excel sheets as well so that you can compare. Okay. In module 4, weekly assignment, you would need this Excel sheet to answer the questions. So make use of that. And in the next week, there is a team group assignment as well. Okay, the weekly assignment is a group assignment. So for next week, Team Red and Team Blue, we will be sending you emails on when do you want to meet in different teams. So Team Red will meet in a different time, Team Blue will meet in a different time. You will discuss your assignments, and then you will prepare them and share it on the platform. So this is another way of us promoting collective work, promoting togetherness, teamwork, so that you can learn from each other as well. Okay, so do make time for that. We'll give you some time slots for each teams so that you can work together. Okay, with that, I end this session. I don't see any other questions, so I have to end this session, and I apologize, it took more time than we had initially imagined. Okay, all right. Have a good time, have a good day. If anyone, I see Princely very happy here, Newzile very happy. Other people, if you want to show your faces, it would be great.
Yeah, especially ITEL, Infinix Hot 5, Infinix Hot 7. I don't know who you are. It would be good if you could let us know who you are.
Switch on their cameras for a second before we log off. I mean, if you can't, that's okay. Okay, we see some nice faces. Yes, great. Amazing. All right, everyone. Thank you so much for joining us again. Make sure you're following your course, especially to them who are behind. Please finish your courses, and it's also required. It's mandatory to finish your course on the platform. Otherwise, you won't get your certificates. All right. Bye, everyone.